Well, as we talk about COVID-19 in this country, certainly a lot of the focus right now is the return to school. Many parents having questions about just how safe that is. And to discuss this today, we're joined by Dr. Dina Kulik. She is a pediatrician, but also the founder and director of Kidcrew Pediatrics, and she joins us in Toronto. Thank you for joining us today, Doctor.
Good morning. Thanks for having me.
Listen, I want to get right to the questions because we have so many. We've been soliciting questions all morning, and I'm going to begin with one question that comes to us from two kindergarten teachers, Tracy Goodwin and Christina Lawford. Now, they're concerned about physical distancing and spreading germs in the transmission of COVID-19. And their question basically is, should they change clothes at school before heading home?
It's an excellent question from Tracy and Christine. We were recommending that early on, and a lot of people still recommend that. For people like myself, who are healthcare providers, many of us will change just before we go to work and then change back to other different clothes when we arrive back at home and launder those clothes right away. We're not really sure how much COVID is transmitted on clothing, though. So if you want to be the most cautious you can be, that would be a good idea. And until we have further evidence, if you want to be really cautious and really protect your family who are at home, if you might be infected at school, even if you're asymptomatic, by asymptomatic carriers like those children, then the best bet, if you want to be very conservative, would be to change on your arrival at home and even shower, but for sure wash your hands very diligently on your arrival home.
What about the type of clothes that one wears? Are there any materials that teachers should be wary of, should not be wearing in a classroom?
We're not really sure about materials yet. We know that COVID can linger on metal surfaces and glass surfaces and plastic surfaces and cardboard. But in terms of clothing, we don't know how long and what types of fabric it might cling to more or less. We're not aware of that.
Okay. Let's bring in another question. This is from Stephanie Lake, and she is emailing us about bubble classrooms. And she wants to know, how does that work if a family has multiple children all in different grades?
Yeah, so that means that your bubble is bigger, right? So once we head back to school, or even if you're planning on doing homeschooling with what people are calling learning pods or teaching pods, that would mean that either your children are podding just by themselves or they're podding with others outside of your home. Ideally, we make sure that these these pods are less than 15 kids per group. Certainly, if you have, for example, I have 4 children. If I were to put each of my 4 children in their individual classrooms at school or in a pod and they're different from each other, that pod has to stay quite small, because if it's large, you're going to have 15 kids in one group and 15 kids in another and 15 in another. And all of those people have their own families as well that they're, podding with as well. So we want to keep in small groups as much as we can, as well as in the classroom setting.
Mm-hmm. As you say that, I'm thinking about older family members, though. If your current personal bubble, for example, includes grandparents, we know that COVID-19 hits people of older age harder than those who are younger, certainly kids. So if a child's bubble at school, if you have multiple children, your bubble's increasing, what does that mean about the kind of time and exposure you can have with grandparents if they are currently part of your family bubble?
If you're heading back to school or you're back to work and you're exposed to other people close by, I would be very hesitant to be close with people like grandparents or aunts and uncles, or even parents that might be higher risk, or older people. As you say, these people are at higher risk of getting very sick with COVID and potentially dying from COVID. So when my kids head back to school, if they go back in the physical setting, which I'm still debating about, like so many other parents out there, we will probably start to maintain a distance of my own parents who are healthy, but they're higher risk just based on their age.
Okay. Another question here. This is from Mary Febraro, and she asked the following question. Would my child and all children within an exposed school bus or group be required to isolate for the recommended 14-day period? Should all family members of each child do that as well? And I guess this goes to, if one child is infected, does that mean that everyone in their school, classroom, in their bus, would they be isolated?
It's a good question. I mean, ideally, again, if we're going to be the most conservative, that would be the case, because if one kid has it, we're anticipating that unless there was really amazing hand hygiene, amazing mask wearing, amazing distance between kids, that the rest of the class could be infected. And therefore, if those kids are going home and not maintaining distance because they're going home to their own bubble, their own pod, that those family members can have been exposed as well. So yeah, at the most conservative end, all those people would be isolated. And we're seeing this in a case in Georgia where there was an outbreak this past week where all 800 people that were potentially exposed are now in isolation, and their families as well.
How does that apply for families, though? If, for example, you have multiple children and say one child is in a classroom where someone's been diagnosed, that one child would have to self-isolate, as you say, in the perfect world. But does that mean that the whole family, and including those other children, would have to isolate as well, just as a precaution?
Ideally, because we know there's so much asymptomatic spread, if one child is exposed, they might have it, even if they test negative, even if they have no symptoms. That means that people in their pod and their bubble at home could be infected as well. So yeah, in the ideal world, we would all be isolating so that one person, let's say, your child gets exposed, comes home, infects your other child, they both may be asymptomatic. That child now goes back to school, could potentially infect their whole classroom and then spread and spread and spread. So yeah, the most conservative way would be to isolate anyone who's been exposed and the people exposed to those people.
Okay. We have so many more questions, and I have to say to people at home, we're going to speak to you again in the next hour. So happy news for them. But before we end this segment, one final question for this moment. This is from John Grimley, who's in Toronto. And John is asking the following question. What arrangements are in hand to pre-test students and staff before September the 8th? Should all students test themselves before going back to school?
It's an excellent question. This is going to be a province by province, municipality by municipality decision. Personally, I wouldn't recommend that everyone necessarily get tested preschool if they're asymptomatic. We know that the testing is not accurate, particularly not accurate if you're asymptomatic. And I think we'll find out later on that the numbers in terms of testing for children is even more unreliable. I've taken care of lots of kids whose parents had COVID, their siblings had COVID confirmed, they have the same symptoms, and yet they swab negatively. So I don't want to give people false security or false hope that they don't have it. If you're symptomatic, stay home, period, even if you swab negative. And similarly, if you have family members that have COVID or confirmed COVID, suspected COVID, they're waiting for testing, etc., I also think those kids should stay home.
Jenrietta Bukovetsky, and I apologize if I don't get that correctly, but this is what she writes. I am picking up my two grandkids, 7 and 9, from a school bus. Can I bring them inside my house until a parent would come and pick them up?
It's a great question. It also depends on the health of this writer. If this person is older, presumably they're older than the parents, being that she's the grandmother, if she has any health concerns, heart-related, neurologic, respiratory, or otherwise, I would be very, very cautious. If she's picking them up, and oftentimes we're relying on our family and our friends to do this kind of work for us, if we're working outside the home as well, I would be wearing a mask. I would try to maintain my distance as much as possible. And I would be hesitant to bring inside the home if there's like a porch or an outside space they can stay in, just because kids will touch surfaces and we know that COVID can spread on surfaces. At the very least, I would wear a mask. I would try to maintain distance, and I would make sure the kids and you use good hand hygiene with either hand sanitizer or washing well before entering the home.
Is there an age that people need to be more concerned about? This one viewer describes herself as a grandmother, but that could be anything from someone in their 50s to someone in their 80s.
Sure. We know that the higher risk starts to increase. Some people say 50, but for sure 60 and older.
Okay, good to know. Grace Liao, she asks our next question. She writes, what should vulnerable family members do if a child in this home is going back to school in September? My sister and her family live with my parents right now, both of whom have an underlying medical condition which may make them suffer more if they get COVID-19.
This is such a hard one, and this is a common thing for a lot of families that I'm speaking to, whether they have a newborn at home or a child with health condition or an older parent or family member at home. It's a tough one. I mean, as much as you can separate, I would do so. If you're able to not send your kid, at least not at the beginning until we know more about how much transmission we're going to have early on. I mean, a lot of daycares have gone back in Canada. A lot of camps have gone back in Canada. And when they've restricted the numbers to 10 or less, or in some places 15 or less, and maintained a lot of outdoor, education or outdoor play space, and washing hands and wearing masks when possible, and having the providers wear masks, and again, really good hand hygiene, we haven't seen a dramatic rise in a lot of Canada. So if we can maintain a smaller classroom setting, maintain our distance, really careful hand hygiene, and staying home when we're sick, hopefully we can prevent a huge wave again.
Is this just one of those stark choices that if your kid goes back to school, then grandparents are basically out of the picture?
I think a lot of people are feeling this way because they want to be conservative and they want to be cautious. Until we really see what it looks like when we go back, how big the classrooms are going to be, what is the rate of transmission, how much do we have a resurgence in cases. Until we see that, the most conservative thing would be to maintain your distance from people that are at risk.
Okay.
Albeit that so hard
Yeah, so hard on so many levels for the people involved. Let's bring in Ted and Sherry now, because they want to know more about safety on school buses. They are asking, how can students protect themselves while in an enclosed space like a school bus?
Right, so it'd be the same kind of idea as being in the classroom setting. If you can, I would wear a mask. I hope that, at least for now, while the weather is nice in most of the country, that we keep the windows open for more ventilation. And if we can maintain distance by, not necessarily having 2 or 3 kids per bench, but separating kids out. But that's going to be difficult when we may need more buses and more staff to drive the buses. And of course, it also puts the bus drivers at risk, who are going to be usually older adults.
Mm-hmm. Well, certainly we're already hearing some concern, because many school bus drivers are actually retirees, and they may not be the right health profile to be taking on this job in this moment in time. Another parent asked this question: how do I, in good conscience, put my kids on a school bus? What do you have to say about that?
I think it's a family decision. A lot of people have to go back to a physical workplace. A lot of people can't work from home, or they don't have the opportunity to work from home. People are in a bind, right? I mean, I have 4 young kids, and I am physically at the clinic every day. My husband's able to work from home. That's doable for us. But if he was, let's say, a healthcare provider and could not do so, we would be in a bind. We would be having to resort to sending our kids back to school. This is a really hard time for a lot of families, and there's no right answer. And there's a lot of shaming I'm finding, too, and some guilt associated with this, that your decision is not the best one for your family. And there's a lot of other people that might be, stepping up to tell you what is right or what is wrong for your family. And it's a tough enough decision as it is.
Okay. I want to put in one last question. This is from Annie Bélanger. And Annie writes the following: my son has a physical disability which requires him to have a full-time education assistant, an EA, to support his needs at school. EAs are typically supporting several students with many needs, some immunocompromised, on a daily basis, moving to and from various classes. I would like to hear how my son's needs, as well as others, will be kept safe while fully supported to ensure their academic success.
It's an absolutely incredible question that I don't have the answer to. I think this is going to be dependent on what the school board puts in place. And I agree, I have the same concerns. I take care of many kids with developmental challenges and physical challenges as a pediatrician. And these kids are going to be in a tougher spot when they're used to smaller groups, and hopefully we can maintain those groups, and a lot more burden on the parents, perhaps, if we don't have those extra support workers that could be working more one-on-one or one-on-two, et cetera. A lot of hand hygiene, mask wearing when possible, but we know a lot of these kids are not going to be able to tolerate masks, so it puts us in a tough spot. It's a lot of work for the school boards to determine as well.